Respiratory failure is one of the most serious medical emergencies older adults can face, and it often starts quietly. Let's begin by looking at why the aging lungs become more vulnerable over time. Point 1. Why respiratory failure can affect the entire body. Although respiratory failure begins in the lungs, its effects extend far beyond the respiratory system. When the lungs can no longer provide enough oxygen to the body, every major organ can be affected. The brain relies on a constant supply of oxygen to maintain memory, concentration, and clear thinking. The heart depends on oxygen to pump blood effectively throughout the body. The kidneys need oxygen to filter waste and maintain proper fluid balance. When oxygen levels fall, these systems may begin to struggle. Many older adults are surprised to learn that respiratory failure does not always begin with severe breathing distress. In some cases, confusion, unusual fatigue, poor concentration, or increasing weakness may appear before obvious respiratory symptoms. Because these signs can be mistaken for normal aging or another illness, the underlying problem may go unrecognized. As oxygen deprivation continues, the body is forced to work harder to maintain essential functions. The heart may beat faster, the brain may function less efficiently, and other organs may begin to experience stress. This widespread impact is one reason respiratory failure is considered a medical emergency. The longer the body goes without adequate oxygen, the greater the risk of serious complications. Understanding that respiratory failure affects the entire body, not just the lungs, helps explain why early recognition and prompt medical evaluation are so important. Point 2. The hidden threat of aspiration pneumonia. Aspiration pneumonia occurs when food liquid, saliva, or stomach contents accidentally enter the lungs instead of the stomach. While this can happen at any age, the risk increases significantly in older adults. Changes in swallowing ability, certain neurological conditions, stroke, dementia, and general muscle weakness can all make aspiration more likely. When foreign material enters the lungs, it can introduce bacteria and trigger inflammation. This may lead to a serious lung infection that interferes with normal breathing. As inflammation spreads and lung function declines, oxygen levels may begin to fall. In severe cases, respiratory failure can develop. One reason aspiration pneumonia is especially dangerous is that it often develops quietly. Some older adults may not remember choking or coughing during a meal. Others may experience only subtle symptoms at first, such as fatigue, weakness, reduced appetite, or confusion. Because the signs are sometimes less obvious than those of typical pneumonia, diagnosis may be delayed. Healthcare professionals often pay close attention to swallowing difficulties in older adults, because preventing aspiration may help reduce the risk of serious respiratory complications. Recognizing swallowing problems early and discussing them with a healthcare provider can be an important step in protecting lung health. Point 3. Why pneumonia is one of the leading triggers. Pneumonia is one of the most common causes of respiratory failure in older adults. The infection causes inflammation inside the lungs, making it difficult for oxygen to pass into the bloodstream. As fluid accumulates in the air sacs, breathing becomes less efficient, and oxygen levels can begin to drop. What makes pneumonia particularly concerning after age 75 is that symptoms are not always obvious. While some individuals develop fever, cough, and chest discomfort, others may experience confusion, weakness, or unusual fatigue as their first symptoms. This can make early recognition more challenging. As pneumonia becomes more severe, larger areas of the lungs may become affected. The body must work harder to obtain the oxygen it needs, and the lungs may eventually struggle to keep up with demand. When oxygen levels fall too low, respiratory failure can occur. Prompt medical evaluation for worsening respiratory symptoms may help identify pneumonia earlier and reduce the risk of severe complications. Point 4. Why chronic lung disease increases the risk. Chronic lung diseases, such as chronic obstructive pulmonary disease, often called COPD, can significantly increase the risk of respiratory failure. These conditions gradually damage the lungs and reduce the body's ability to move air efficiently. Many older adults with chronic lung disease live with symptoms for years and learn to adapt to them. However, this reduced lung function leaves less reserve capacity available during illness. Even a relatively mild respiratory infection may place considerable stress on the lungs. When inflammation mucus production or airway narrowing worsens. Oxygen levels can decline rapidly. The lungs may no longer be able to meet the body's needs, increasing the risk of respiratory failure. This is why careful management of chronic lung disease and attention to worsening symptoms are important components of respiratory health. After age 75. Point 5. The early warning signs are often subtle. One of the greatest challenges is that respiratory failure often begins with symptoms that seem mild. An older adult may feel more tired than usual, lose interest in normal activities, or become short of breath during routine tasks. Because these changes can develop gradually, they may not immediately appear serious. Point 6. Confusion can be a serious warning sign. Low oxygen levels can affect the brain before severe breathing problems become obvious. An older adult may appear unusually forgetful, confused, sleepy, or less responsive than normal. Sudden changes in mental status should never be ignored. Point 7. Low oxygen can strain the heart. The heart must work harder when oxygen levels begin to fall. For older adults with existing heart disease, this additional strain may increase the risk of serious complications. This is one reason respiratory failure can become dangerous very quickly. Why respiratory failure can progress rapidly. Not every case develops slowly. In some situations, respiratory failure can worsen dramatically over a short period of time. A respiratory infection that initially appears manageable may suddenly become much more severe as inflammation spreads throughout the lungs. As oxygen levels continue to decline, symptoms may intensify. Breathing may become increasingly difficult. Weakness may worsen, and confusion may become more noticeable. Family members often report that a loved one seems stable only a day or two earlier. Because respiratory failure can progress quickly, worsening symptoms should not be dismissed early too. Medical attention may help prevent complications from becoming more severe. Point 9. The impact on the brain. The brain is highly sensitive to changes in oxygen levels. Even a modest decline in oxygen delivery can affect concentration, judgment, memory, and alertness. Some older adults become confused. Others may appear unusually sleepy or have difficulty following conversations. These symptoms can sometimes be mistaken for fatigue or age-related memory problems. In more severe cases, prolonged oxygen deprivation can lead to serious neurological complications. This is why changes in mental status are considered an important warning sign. Point 10. The impact on the heart and other organs. Respiratory failure affects far more than breathing alone. As oxygen levels fall, the heart must work harder to circulate blood throughout the body. This increased workload may place significant stress on an aging cardiovascular system. The kidneys, liver, and other organs also depend on a continuous supply of oxygen. When oxygen delivery becomes inadequate, normal organ function may begin to decline. Over time, widespread oxygen deprivation can contribute to multiple organ complications, which is one reason respiratory failure requires urgent medical attention.